Hi, good day everyone. My name is Ihgie Canales. This morning I am going to discuss my topic, which is entitled The Counselor and the Health Psychology. So, first we will have first the definition of a counselor. So, a counselor is a person who give advice or who counsel people who has a problem. So he is also or she is also a lawyer, especially one that give advice in the law and manages cases for clients in court. So this is similar to advisor, consultant, guide, a monitor or the mentor or the confidante. So he is a personality type, also called the counselor because of their tendency to be idealistic, compassionate, and sensitive. So I have here another definition about the counselor. So a counselor also is a person who is specifically trained to provide advice, as what I have said, no. So or a person who turn to for you to advise, to give advice, no guidance. An example of a counselor is a professional who you go to in order to talk about our problems and learn solutions for coping with stress or sadness. So they are going to help with the people uh, in order to resolve their problems, in order to solve the problem of the client. So the counselor must give guidance and give advice what does the client do. Counselor also is a trained or objective professional with whom you can build a healing and trusting relationship. So by this, the counselor also gave a healing trust with the client, trust the relationship with the client regarding with you as being as a counselor. So they are trained to offer different types of assistance, most frequently talking based styles of and therapy. So there are questions. How counselors define counseling? So by the way, what is counseling? So the counselor defines counseling. First, counseling refers to guidance or advice provided to help someone resolve difficulties or decide issues. So they are, as what I have said, the counselor give the guidance and advice to the client. So they are the one to help the client to resolve difficulties or decide issues of what they are facing in. So next, this is the interaction which occurs between two individuals called the counselor and the client. So counseling, when we say counseling, this is interactions between the two individuals, the counselor and the client. So that is what we call what does the counselor define counseling. So it takes in a professional settings also. It takes initiated and maintained facilitate changes in the behavior of the client also. So another definition about the counseling is this counseling is a process of taking about working through with your personal problems. So with a counselor. So the counselor helps you to address your problems in a positive way. So they are helping you to clarify the issues, explore options, develop strategies, and increase self-awareness, no? So for some people, just the process of telling your story about with the counselor and being listened to, it is very helpful and necessary, no? So a trained counselor is someone who trained to offer talk-based therapy. So there are many types, different types of talk-based therapy. So a counselor will work with a partnership with a medical doctor or other health professionals at that time, so to give a comprehensive and integrated care. So counseling also provides confidential support. This means that everything you've discussed with the counselor, this also a private, no, between you and the counselor. So the exception is when the counselor has a duty of care to report the or something that threatens your well-being or the other well-being of others So this legal requirement will be explained to you and in your first counseling session. So that is being discussed when or explained during first counseling session. So there are few benefits of counseling. So the first one, we have loss of anxiety. So what is this loss of anxiety? These steps is often involve getting your mind away from the sources of stress. So exercise, mindfulness, music, physical intimacy, going somewhere like that. Yeah. This is can all your work relieve anxiety. So, and improve your overall work balance as well, no? So, that is how we're going to have less of anxiety. So, the next is the fourth one, regaining emotional balance. So, what is this regaining emotional balance? So, how to stay emotionally balanced, man? So, use the following use the following strategies to take care of yourself. So physically and ensure that your emotions stay in balance. So first, we have physical health, of course. Take care of yourself when you are sick, of course. So eat healthy meals. Eat balanced meals and ensure that you are getting enough to eat. Then third, we have to avoid drugs and alcohols. Fourth, we need to sleep well. Dayon, exercise regularly. So that is how we are going to regaining emotional balance. So that is what we are going to do. So we will proceed now to the health psychology. So what is health psychology? Health psychology, this is the study of a psychological and behavioral process, no, in health, illness, and healthcare. So it is concerned with understanding how psychological, behavioral, and cultural factors contribute to physical health and illnesses. So it also examines how biological, social, and psychological factors influence our health and illness. So health psychologists use psychological science to promote health and prevent illness and improve healthcare system. Third type of counseling, we have the rehabilitation counseling. So this type of counseling refers to practice where the counselor helps people with other emotional and physical disabilities. So furthermore, these counselors teach these people no ways to live independently and maintain gaining employment, and it evaluates the strengths and limitations of their patients. So in short, so they help in guiding them and assessing them to lead independent lives. So that is the rehabilitation counseling. So next, we have the mental health counseling. So mental health illnesses have become very common, no, or nowadays. So awareness has helped people identify the symptoms and visit a mental health counselor. So mental health counseling helps people deal with issues that impact with their mental health and well-being. So some of the mental illnesses are depression, no, the PSTSD, and the ADHD, and the bipolar disorder, and etc. So this counseling focuses on these issues and helps in resolving them for a healthier life. So we will proceed now to the health psychology. So what is health psychology? Health psychology, this is the study of a psychological and behavioral process, no, in health, illness, and healthcare. So it is concerned with understanding how psychological, behavioral, and cultural factors contribute to physical health and illnesses. So it also examines how biological, social, and psychological factors influence our health and illness. So health psychologists use psychological science to promote health and prevent illness and improve healthcare system. So we have why is a psychology needed? So that is the question, no? So the first reason why psychology is needed, this is changing illness patterns. Second, we have aiding technology and research. Third, we have offering quality and health care services. And the last one, we have the health related policy making. So those are the four main reason why health psychology is needed. So I have here a healthy lifestyle diagram. So your heart is the center. So your heart is we have here environment, a relationship, a nutrition, a body care, fitness, sports, mindset, relaxation, healthcare, and stress management. So environment, this is human health, no, why it is important that we need to have a good environment man po. So the good environment can influence us, no. So human health and well-being are intimately linked to the state of environment. So good quality natural environments provide a basic needs. So in terms of clean air, water, fertile land, and food production, and energy and materials inputs for production. So of course, once our environment is not good, so our health also is not healthy, no. So we're not healthy. So we must have a good environment to feel our to have a better health. So why is a relationship important to our health? So a healthy relationship can decrease man's stress and lead to a longer life. So we must have a good relationship with our family, relatives, and friends, no. So requests suggested to social and emotional support from a committed relationship or strong relationship can be a buffer against stress. So that is how biological benefits, including lower blood pressure and stronger immune system. So in ana ang na ay good relationship. Why is having a good nutrition is important to our health, man? So what is a good nutrition and why it is important to our health? So good nutrition, it is very important for your body and processes, no. It is important to have a balanced diet, no, rich in all nutrients, and to ensure that our bodies no deficiency, no, or hormonal imbalances. So and created in our bodies. So nutrition is also important for you to boost your immunity and give it the ability to fight against the diseases. So we need to eat nutritious foods like vegetables, no, fruits, like that. So we need to eat nutritious foods. Why is having a good nutrition is important to our health, man? So what is a good nutrition and why it is important to our health? So good nutrition, it is very important for your body and processes, no. It is important to have a balanced diet, no, rich in all nutrients, and to ensure that our bodies no deficiency, no, or hormonal imbalances. So and created in our bodies. So nutrition is also important for you to boost your immunity and give it the ability to fight against the diseases. So we need to eat nutritious foods like vegetables, no, fruits, like that. So we need to eat nutritious foods. For health also, we need to take good care of our bodies. So taking a better care of our bodies means that increase energy levels, and a better ability to accomplish our daily goals. So it means that a better ability to concentrate or any given task, no, and that our task is a less time to complete. So we need to take good care of our body. So why fitness is important to our health? So having regular exercise, it is very important. No, physical activity promotes a strong muscles and bones, so it improves also your respiratory, cardiovascular health, and overall health. No, so staying active can help you maintain a healthy weight, reduce risk type of to diabetes, no, so heart disease, and reduce your risk for some cancers. Sports also is needed to our health because sports can help control diabetes and manage weight also, enhance blood circulation, and manage levels of stress, no. Through sports, there is a good balance of your physical and mental growth. So we need to join sports like basketball, volleyball, no, and etc. So which helps tone muscles and makes your bone strong. No, sports inculcates and students or people importance. This is how we're going to have a healthy lifestyle, no. Ang mindset also can affect your health. So, kung dili maayo imong mindset, of course, your health will be affected, no? So, mindset, this is a strong and positive one, no? This is a very essential to by developing your healthy life esteem. So, it is important tool that affects our daily self dialogue and reinforces our most intimate beliefs, attitudes, and feelings about ourselves, no. So of course, we need to have relaxed pod. So relaxation, what is this a relaxation? Why is very important to our health man pod ang relaxation? So relaxation, this is to reduce stress and the symptoms of mental health and conditions. So like depression, anxiety, schizophrenia. So relaxation also has other related health benefits also. So kinahanglan pod i-relax pod ang imong mind, no? Imong lawas, no? So including lower your heart rate, blood pressure, breathing rate, reducing muscle and tension and chronic pain. So how are we going to manage our stress, no? So under a stress, managing stress is very important because stress management gives you a range of tools to reset your alarm system. So it can help your mind and body adapt. No, without it, your body might always be on high alert. So over time, chronic stress can lead to be a serious health problems. So I have here also health healthy life diagram, no? Healthy life diagram. So healthy life, eat healthy, then drink plenty of water, reduce stress, then exercise regularly. So your health, your health is connected to your body. Your health is connected to your mind, and your spirit connected also to your health, no? Health body, then health mind, then health spirit. Psychology, we have the goals of the health psychology. So there are 8 major goals of a health psychology, no? First, we have understanding the behavioral and contextual factors of health and illness. Second, we have preventing illness. And third, we have investigating the effects and disease. Fourth, we have providing a critical analysis of health policies. Fifth, we have conducting a research to prevention and intervention of health problems. We have also improving doctor-patient communication. And the last one, we have improving adherence to medical advice.
There are current issues in the health psychology. So, health psychologists work with individuals, no, groups, and communities to decrease risk factors, no, improve overall health, no, and reduce illness. So, they conduct research and provide services in the areas. So, including first, we have the stress reduction, weight management, smoking cessation, improving daily nutrition, reducing risky sexual behaviors, hope-based care and grief counseling, preventing illness, understanding and the effects of illness, then improving recovery, and the last one we have teaching coping skills. So the biosocial model in the health of psychology. So today, the main approach in the health psychology is known as biosocial model. So according to this view, illness and the health are the results of a combination of biological, psychological, and social factors. So there are three factors. The first one, we have the biological factors, psychological factors. In the last one, we have the social factors. So what is this biological factors? This is include your inherited personality traits and genetic conditions. Psychological factors, it involves your lifestyle, your personality characteristics, and stress levels. While the social factors, it includes such things as social support system, family relationships, and cultural beliefs. So I have here an example of a biological factors. So what are the biological factors of health? So examples of biological, genetic, social determinants of health include your age, your sex, no, your IHB status, your inherited conditions such as sickle cell anemia, hemophilia, and cystic fibrosis, no, then carrying the BRCA1 or the BRCA2 or gene, no, which increase a risk for breast and ovarian cancer, then family history of heart disease. So that is the examples of biological factors. Examples of psychological factors, no, a few examples of psychological factors are the nature of the significant childhood and adult relationship, the experience of ACE or stress in social environment like school, work, and the experience of trauma. So, while examples of the social factors, so socially factors are the things that affect someone, your lifestyles, no? This could include your wealth, your religion, your buying habits, your educational level, no, your family size and structure, and population density. So, health psychology is a specialty area that focuses on how biology, psychology, behavior, and social factors influence health and illness. So, in other terms, including medical psychology and behavioral medicine are sometimes used interchangeably with the term of health psychology. This is the last part of my report, no? So illness engage three types of illness prevention. We have three types of illness prevention: the primary, the secondary, and the tertiary. So primary, preventing an illness from occurring in the otherwise healthy people. So examples of a primary prevention, we have programs are childhood immunization, condom use, HIV awareness campaigns. Well, the secondary, this is focusing on the early identification and treatment of a developing illness or disease. So, secondary prevention programs include the breast cancer awareness campaigns and the promotion of the self-examinations for testicular cancer. And the last, we have the tertiary. This is helping people cope, prevention for health psychologists, and health psychologists will already develop diseases and preventing them, from getting worse. So the tertiary prevention programs include helping people to reduce high blood pressure, quit smoking, and treat obesity. So that is the end of my topic, the counselor and the health psychology. Thank you, keep safe, and God bless.